There could be a simple solution to freeing up hospital bed space in Colorado, because hundreds of people hospitalized do not need to be in a hospital anymore. But as Mark Salinger found out, staffing shortages in nursing homes give them nowhere else to go, and long-term care facilities can't afford to open up more beds.
It's no secret nursing homes have faced challenge after challenge during the pandemic. Now there's a new one.
You have people right now that are sitting in Colorado hospitals that should be in long-term care settings that can't go there because there aren't workers to care for them.
The state estimates more than 300 people are waiting tonight to be transferred out of a hospital and into a nursing home or care facility. Doug Farmer with the Colorado Healthcare Association says there's plenty of space in nursing homes.
There are somewhere in the neighborhood of 6,000 vacant beds in the state of Colorado right now.
That's higher than normal, but not all of those beds are staffed.
Because of their staffing challenges, they've had to close, say, an entire wing or an entire unit. And so those beds are available, but they're unstaffed.
Mike Willis is the director of the Colorado Office of Emergency Management. He's leading the effort to try and find enough people to staff every facility in the healthcare sector. The extra patients in hospitals are making an impact.
The shortages in the long-term care facilities restrict the hospital's ability to transfer those patients out of the hospital.
We know by now the entire state is short-staffed. But when it comes to nursing homes, Doug thinks he knows why.
In many instances, it is most definitely price gouging.
He says staffing agencies are hiring employees away from their facilities and offering to pay them more. The staffing agencies then turn around and charge the care facilities a lot more money to hire them back.
The staff member themselves may make a little bit more money, but in reality, most of the increased cost is going into the pocket of the staffing agency.
He says it's gotten to a point where care facilities are forced to admit fewer people than deal with the increased costs. So the Colorado Healthcare Association is the advocacy group for long-term care facilities in Colorado. They say they're working with the state to try and get more funding to open up more beds. So what's the long-term solution here, Marshall? It might just be convincing more people to go into healthcare so that years down the line, you have a steady stream of people going into the industry.
All right, you were talking about the story in the newsroom, and I said, what's stopping a long-term healthcare facility from saying, we're no longer going to accept hires from the staffing agency and start to put up a block so that they can't go to the staffing agency?
It's a worthy question, but then you have facilities all across the entire country competing for those staff members and saying, we'll pay more, bring them over here. Staffing shortages are everywhere. So the way that the emergency management director told me today, he called it a competitive market. So
anything to reduce hospital bed space for sure, but more power to people who can go from the one job, leave, and come back for twice the pay.
Although most of that money that goes when they come back for more funds, most of that money is going to the staffing agencies. It's not going directly into the pocket of the nurses and everybody working at those agencies.
Now we have a conundrum.
It's a problem.
Name Doppelganger. Good to see you in person here.
Thanks, Marshall.